Large breasts can limit physical activity and cause pain and discomfort. Where Dr. Mitchell Henry joins us now to talk about one solution, and that's breast reduction. Now, Dr. Henry, plastic surgery is a big decision. What should women consider before having a procedure like this?
Well, you want to make sure that that you have symptoms that would necessitate having a procedure like a breast reduction. And that would include either back pain, shoulder pain, neck pain. Some women get rashes under their breasts if they're large, and that would be another consideration.
I know a lot of people want to know about scarring when they're considering a procedure. Is there any with breast reduction, and where are the incisions made exactly?
The incisions are usually made around the nipple areola and down below that, straight down to the inframammary fold, and then you'll have an incision underneath on the fold area.
Now, how do you determine the amount of tissue that's going to be removed?
Well, it's partially from experience,
Okay.
from having done lots of breast reduction procedures, and judging the size that they are at the time that they come in, and then also talking to the patient to determine what kind of size they wish to be, and seeing if the amount to be removed will help their symptoms and still give them a nice result in the size that they wish to be.
Let's talk recovery for a little minute. What's that like, and what's the time frame like?
Recovery, they usually stay in the hospital a day or two, and then they go home and do normal daily activities. They're not to be doing any lifting or strenuous activity.
Okay.
And that's usually for 4 to 6 weeks. And usually in a week they're back to doing normal stuff, normal daily activities.
Is this something that's covered by insurance?
Yes, usually insurance company will cover this if it's for a functional reason, for symptoms that they're having. And usually if a woman has fairly large breasts, they do have those kind of symptoms that we talked about.
We've just got 30 seconds. Usually with surgery there are some risks involved. What are some of the risks that women should know about if they're considering this?
Well, one of the main things, it's not an absolute contraindication, but it is a relative, is smoking. Because smokers have more of a risk of having loss of tissue, and especially for plastic surgery procedures, that's a big thing. And I usually require my patients to stop smoking for at least a month before any type of procedure.
All right, Dr. Henry, always good information. Thanks for coming. For more information on breast reduction, go to momseveryday.com and find the Healthy Wednesdays button. Then click on the Dr. Mitchell Henry page.
Moms Every Day with Cerise Cole. Weekdays at 8:55 a.m. is brought to you by the sponsors of momseveryday.com.